So, with TB, it's mostly associated with poverty. So when we are in poverty-stricken areas, people are scared to actually come to facilities to receive their treatment as well because of the stigma that is associated towards this particular TB infection.
The main challenges that they face daily, it's actually discrimination. And for them to come out, sometimes they are scared. Sometimes they are scared of being judged.
It's evident that TB is a problem. Why is TB such a problem in the field? Why are clients not reporting, or when they report symptoms, they are resistant to going to the facility? And the common answer I get from the team is that there is a lot of stigma surrounding TB.
We see a lot of delayed health-seeking behavior because people are scared to come forth to speak about their symptoms, scared to go to clinics to actually get help because they're associated with poverty, fear, and there's a great link between TB and HIV.
For example, if they are TB positive and they're taking treatment, they need food. And without the access to food, then they can't really adhere to their TB treatment. So for them to get food access, they need to be in feeding schemes, they need to be in shelters, and they're resisting them as it is. So the stigma around is really disturbing and it's saddening in our community.
There's a large fear linked to being judged by friends, by family, by colleagues at work, which really keeps them from coming forth to seek help. For example, we see clients that would rather even take their HIV medication at a clinic that's far away from their home, so it's not linked to them. We have patients where we offer TB delivery service to actually get their medication to them at their houses, and they actually declined. They said they would rather come and collect it themselves because they do not want anybody in the community knowing that they have TB out of fear of relating that to an HIV status.
One of the things that we do, we need to make sure that we sensitize your healthcare sectors where we're teaching these service providers that there's harm reduction strategies. We do your stakeholder engagement where we're meeting with a lot of stakeholders where we're engaging and saying we need you to learn about these services and learn about harm reduction and learn that we are here and we need access to treatment.
So people are not getting enough information. That's why we are there. We are here to educate the public. So as you can see right outside, we've got pamphlets that we give to people to make sure that we educate them about TB. We also do have our ANAs that do provide that health education to the community at large as well. And because we are trying to do what? To actually lessen those stigmas so that people can actually come to our facilities and get tested and as well as be linked back to care.
So on our side, we really do need to promote accurate health information, and that information needs to be easy to understand and in a language that people can understand it. And this information needs to be given on multiple platforms. We need to spread the right information, and that's done through campaigns, such as the campaigns that our NGOs run, where we go into the communities, we provide health education, we give access to good quality TB screening and linkage to healthcare, so people can be informed about the health decisions that they make. So these are a lot of the barriers that need to be broken down and the stigma that needs to be broken down, because we need to know that you can live a long and healthy life with HIV and that TB is curable.
I can clearly say that we are on the right track, especially with the support from organizations like Nacosa. Nacosa as a funder allows that we start to dig up the issue of TB, to start stamping on the stigma and discrimination that is surrounding TB, to mitigate or to eliminate all these issues among key vulnerable populations that cause TB to become a killer condition in our country. We may be able to advocate for more policies that are in place as community-based organizations that support key vulnerable populations to get access to services that allow them not to get infected with TB.
It's a fight that we want to win. We say that we want to beat TB by 2030. That's what we're actually trying to do. We can beat TB just as long as we can just get screened for it, and then we make sure that we take our medication. Of course, we can actually beat it. So I say we beat TB.